I'm in the midst of working with a lot of patients who have skin problems that are they're stubborn, they don't go away. So they'll go to their dermatologist and they'll get a little bit of steroid cream and they'll put it on, it'll look better for a couple of days. And then after they stop taking it, 2 or 3 days later, it's worse. So there's something going on there. In general practice, we're told the old mantra is, if it's wet, dry it. And if it's dry, wet it. And if it doesn't get better, go to the dermatologist. But what do you do after the dermatologist sees you and you're not getting better? You got to look deeper. So I have a trick or two for psoriasis and eczema. And it basically goes like this. The top of your skin is sealed almost like with wax paper. And the top of the skin is sealed well unless it breaks down. If there's any breakdown in the skin, instead of tight, it's open. When that skin opens up, all sorts of bugs that live on the skin, that colonize the skin, get in between the cracks of the skin. Once that happens, if you put steroid on top to reduce the inflammation, it gets better for a little while, but those bugs don't go away. In fact, they kind of like the environment where the immune system is suppressed, which is what steroids do. So instead, what you want to do is consider what bugs are living in there and how can I best deal with that? Well, of course, cleansing, so you clear your skin off as best you can with a nice gelatin-based soap, something that's easy on your skin and doesn't strip it. And then on top of that, consider that you may need an antibacterial and antifungal treatment. Natural treatments like tea tree oil and things like that, you want to dilute tea tree down so it doesn't get too stingy, will remove some of the bacteria and fungus that live in the skin. And then, on top of coconut oil, of course, which we've talked about at length, you'll reduce the amount of bacteria and fungus. And in response to that, if you do use steroids, they'll be much more effective. You always want to use the minimum amount of medication, especially steroids that are possible, and work with your doctor. And you'll see that psoriasis and eczema respond much, much better. So get with your doctor and work all that stuff out because we're better together.